maximum contraction, bite, relax, bite. Okay. So I will use roughly 30 units at the minimum, probably 40 on her face. Right. So my plan is to do what I call the Chic Lift. So I'm going to recreate a nice C shape around the eyes, from the brow to the temple, eyebrows, and tear trough and mid-face. For that, I'm going to use a volumizer. So today I'm going to use some Raspaldo products. It's good to have also other idea. Otherwise, if we all use the same product, people has no critical ideas. So I'm going to use a volumizer here on the mid-face, probably 0.5 here, and that's will be my first injection point. Okay, just to create some projection here, and I tell the patient, look at the mirror, I'm going to create this projection. And on the profile, I hope to have this convexity, and you see I will reduce the distance from the eyelashes to the mid-face concavity by creating a convexity. So I reduce this length. That will be number one. So first we build the house, first we build the pillar, first we use the volumizer. So half a cc here, and I'm going to use another half a cc on the temple. Again, I want to create some volume here to create the illusion she has a more thin and triangular face or heart shape. To draw a heart from the eyebrows, finish to the chin. If you reduce here, it's more visible. Okay, so if we do that. By the way, she has a very strong DAO, the pressor angulis and mentalis. So if I have time, I will do a bit of Botox on the mentalis. So that's the number one and number two step, or the Chic Lift. Like this. And then I'm going to use under the eyes another gel, which will be, so that will be Raspaldo Define, and that will be Raspaldo Refine. So I'm going to start laterally, but this is safe. You have no nerve vessels or nothing. And I'm going to use this product under the orbicularis on the periosteum to finish the job on the tear trough. And sometimes I use a triangle here. If you want to reduce the distance here to create the illusion she had like almond-shaped eyes, you can inject a little bit higher, close to the canthus, and you create this projection. So the last point then is to, if you look carefully, the eyebrow is nice. You had it is a makeup, but you have good eyebrows also. And tattoo, okay. So this is tattoo. It's a little bit flat, looks straight. Wow. And she had a bit of excess of skin. So normally we would love to tell her to do blepharoplasty, but she's 36, so maybe it's a bit early. However, there is you're not young enough to do eyelid surgery, especially when you have that. This is congenital. So what I will propose for her is to finish the C shape of the Chic Lift by injecting some Raspaldo Refine again to create this little bit of convexity on the eyebrow. And if you look carefully, it was more visible on her photos, but she has a bit of indentation here, only on the left side. I will use a drop, which is 1.1 or 0.2 ml of Raspaldo Refine. Look at the camera. Look at the camera. Okay. So roughly I have a C shape, like this. Okay? Bon. Why I use all these areas? Just to show you it's very safe. Again, remember, easier to draw as the bone. So you can play with your friends, wife, kids, to draw on the face, the anatomy. If you do this by heart, then you are the best injector. So bone, this is the orbital rim. I will never go, of course, above the orbital rim, always lower than this, which is 2 or 3 millimeter. And then you have the malar bone and the maxilla. Okay? So that's where I want to inject. And it's a safe zone. I wrote a paper about the safe triangle when I wrote the first paper of Voluma in 2005. That's the safe triangle. So you draw a line from the inner canthus down to the corner of the mouth here. The horizontal line, the curve, is the orbital rim, and the last one from the canthus down to the corner of the mouth. Okay? And you draw another line from the nostril to the tragus, which is somewhere I never inject if I want to correct a tear trough, because if you inject here, what you do, you create a convexity here, and you make this worse. Okay, so for me, I never inject this area. I try to stay away higher than the nostril, roughly, or even higher here. So that's the safe triangle, because what are the dangers? First is the facial artery and the veins. So the arteries and veins, they're facial, they start, okay, from the neck for sure, and then just in front of the masseter, sometimes you can palpate the facial artery and the vein. So it's very sinusoid, like this, it's not straight. And then comes to